Hi everyone, welcome back to Acetylcholine Part 2. In this video, we will continue our discussion on what is acetylcholine and what does it do. So in the last video, we finished up by talking about the synthesis and metabolism of acetylcholine and how it flows throughout that synapse. But now we're going to talk about, some of the other stuff. So once it's made, then what does it do? How does it break down? How does the cell know when to make more? Well, it turns out acetylcholine is highly regulated, especially that synthesis of it. And there's actually this feedback loop where high levels of acetylcholine within that presynaptic cell actually inhibits synthesis of further acetylcholine by turning off chat. So if there's no more of that synthesizing enzyme, obviously we can't synthesize more. So if there's too much acetylcholine, we stop making it. Turns out there's also a second one, second thing that regulates the acetylcholine synthesis, and that's that precursor availability. So how much choline and acetyl-CoA is even available to be turned into acetylcholine. Now we talked a little bit about how choline is associated with some dietary stuff, dietary supplementation. So you can increase what you're eating, or we get some of our choline from what we eat. Now we have looked at just giving people like a pill or something of an increase of choline, or suggesting people eat a diet full of foods that contain choline to help with their acetylcholine synthesis or acetylcholine associated things. So such as Alzheimer's has a damaged cholinergic system. However, what we found was that even when these patients ate a diet high in choline, we did not see any significant increase in their symptoms or even in their synthesis of acetylcholine. It thinks that there was kind of two different ways that this system actually failed. One, it didn't improve the symptoms, so we didn't see improved cognitive function in these Alzheimer's patients. But also our choline in the periphery, so not in the central nervous system, it metabolized into this compound called trimethylamine, which is actually, it creates a fishy odor. So people weren't getting their memory or cognition back, and they smelled like fish. So, really, really not great. So we don't suggest that anymore. We don't ask people to increase their dietary choline to improve cognition. Another way that synthesis is regulated is by neuronal activity. So when a neuron is highly active, we'll get more synthesis of acetylcholine because there's more demand for it. When a neuron is less active, there will be less synthesis. So it's really activity dependent. So after it's synthesized, I mentioned it's stored in those vessels, and it's moved into the vessels by the vesicular acetylcholine transporter. You'll see this with a lot of these neurotransmitters. There's a specific transporter for transporting the neurotransmitter into the correct vesicle, okay? Because multiple neurons will actually release and make multiple different types of neurotransmitters. So we need to make sure that the right neurotransmitter is in the right vessel. So the vesicular acetylcholine transporter, or the VAT, is the one here, okay? Transport can be inhibited by the drug vesamicol. You'll notice throughout this course that I'm not great at pronouncing drug names, but I give it a shot, so stick with me. So vesamicol is a drug that inhibits acetylcholine from getting into those vesicles. Now, if acetylcholine can't get into the vesicle, then obviously it cannot be released into the synapse because it's just kind of stuck in this cytosol, and the vesicles are what bind to the synaptic membrane and release its innards. So if acetylcholine can't get into the vesicle, it can't be released into the synapse. So we tend to get an accumulation of acetylcholine in the cytosol, which means decreased release, and that buildup could actually then go back and inhibit chat from synthesis. So this blocks or depletes the pool of ready-to-use vesicles. Acetylcholine is released by classical vesicular exocytosis. In other words, it's voltage-gated calcium influx. Okay, this is the classic, what you probably learned about in other classes. Okay, it's an influx of calcium into the presynaptic cell that causes the vesicles to bind to that synaptic membrane, releasing their innards. So this release can be triggered by latrotoxin, okay, aka black widow venom. This is done in the periphery, so this is why we see results in the neuromuscular junctions, right? When you get bitten by a black widow spider. And we get extra release of acetylcholine where we might not have wanted it. This can cause muscle pain, tremors, nausea, and excessive sweating because now we have too much acetylcholine release or unregulated acetylcholine release. Okay. Reuptake, so once acetylcholine has been bound to the receptor, then it gets released from the receptor, and then it's broken down in the synapse. I mentioned that before. You need to know where the metabolite occurs, okay? So acetylcholine esterase, okay, is present primarily in that synaptic cleft and breaks down acetylcholine into choline and some sort of acid, okay? The breakdown product, or choline, is then transported back into the presynaptic cell using the choline transporter. You'll notice we have very creative names. Wonderful. So most of the choline that is reuptaken, whatever, into that presynaptic cell will be recycled and used to make more acetylcholine. Some of it will not be. Some of it will be broken down fully and removed from the system, and that's why you do need that dietary choline to replace what is removed. But again, you don't need too much of it, okay? We can inhibit this reuptake by using the drug hemicoline-3. What this does is it blocks choline from entering that presynaptic cell that will then decrease the amount of choline in that presynaptic cell, which then decreases the synthesis. But it also leads to more choline in that synapse, okay? And because there's so much choline kind of just accumulating, we get a rundown of activity. So because there's that choline, then it's harder for the acetylcholine to get to those receptors. There's just pretty much like a lot of traffic, okay? So it's hard to get through it all. So not only do we get less acetylcholine being synthesized in that cell, it's now harder for the acetylcholine that is synthesized and released to get to the receptors. Now, one drug that acts on cholinergic neurons would be Botox. So I find Botox fascinating. So Botox is a type of toxin. It's clostridial neurotoxins, isolated from the bacteria botulinum, and it causes paralytic effects, okay? So obviously, you guys have probably heard of Botox as like a cosmetic injection surgery thing, but that's us using it to our own benefits. But you can get botulinum poisoning from other things. So like, that's why you should never buy a can from the supermarket that is dented, because botulinum doesn't like air. So if it's dented, then that means there's no air in there, and there could be botulinum bacteria in there, creating botulinum poisoning. It's a whole thing. But pretty much what happens is that it's a protease, okay? So it creates BONTAB. That's a protease that cleaves VAMP or SNAP25, okay? Pretty much what it does, we haven't talked about these two things, but what it does is it prevents the vesicles from binding to that presynaptic cell membrane. Okay, so it prevents the release of acetylcholine. What that does is it causes the muscle to not be able to move because it needs the acetylcholine in the muscle to tell the muscle to do something, right? It tells the muscle to contract. So without the acetylcholine, the muscle relaxes. Okay? And that's why we use it for some of these therapeutic effects. So like for wrinkles and stuff, it causes the muscles to relax and then you don't get the wrinkles. But we can also use it for cross-eyedness. You inject it into the ocular muscles and it relaxes them. Eyelid spasms, some sort of facial spasms. We also use it for migraines. Again, it has to do with like very tense muscles. This helps the muscles relax. Okay. So we're just doing a local injection of a small amount of Botox to cause these therapeutic effects. But if you were to ingest a large amount of Botox, it could, in theory, lead to death. So that's Botox. Again, I find it fascinating. Now, a lot of insecticides also target the cholinergic systems. And that's because acetylcholine is the primary neurotransmitter of the central nervous system in insects. So while acetylcholine is really like super important in the peripheral system of humans, and it does play a role in the central nervous system as well, but we have so many others. In insects, it's really just acetylcholine, okay? So a lot of insecticides affect the cholinergic systems. So we've got these plant alkaloids, which are secondary metabolites that are commonly synthesized for defense against insects or animal predation. And what they do is they're affecting that acetylcholine and affecting the animals there. Now, the reason why we can use this for insects is the structure of the blood-brain barrier. So most mammals, we have a great blood-brain barrier, but insects don't have as much of a blood-brain barrier, and it's actually formed differently. Okay, so this means that these drugs, these insecticidal alkaloids, can cross the insect blood-brain barrier, whatever, get into the central nervous system. However, in humans and other mammals, then this insecticide is not able to cross the blood-brain barrier, so it stays in the peripheral system, not the central nervous system. Okay? It's very similar to what we see with the black widow venom. That also cannot cross the blood-brain barrier, or it's very difficult to, so we tend to see effects of that more on the peripheral, in those muscles and stuff. Okay? And that's why we're able to use plant alkaloids on, say, food or plants that humans could ingest or animals could ingest, because we know that the insecticide will not affect our central nervous systems. There are also some drugs that affect the breakdown or metabolism of acetylcholine. So acetylcholine esterase inhibition prolongs the acetylcholine signaling, which means we get more of an effect of acetylcholine. And there are some plant-derived toxins that are actually permeable to the blood-brain barrier. So that would be physostigmine, Um, Physostigmine is a acetylcholine esterase inhibitor, okay, found in plants, and it can cross the blood-brain barrier. So this is found in calabar beans, which are very cool. And some accidental poisoning, so if you eat some calabar beans, if they're not prepared correctly, it can lead to slurred speech, confusion, hallucinations, etc., even death, because it acts on that central nervous system. So this is more dangerous to humans than those insecticides. So calabar beans were reportedly used in the 19th century, especially in West Africa, to determine the accused prisoner's guilt. So after administration of these calabar bean extract, the prisoner would be found not guilty if they either regurgitated the extract or if they were able to walk 10 feet. If they could do that, then they were not guilty. If they could not do that, then they were found guilty. Okay. Well, it turns out most people could not manage their feet because this poisoning, it affects us. It affects loss of reflexes. Well, you can't walk if you don't have reflexes, right? So it was very, very tough. If someone was able to do it, they would then induce vomiting, so the person wouldn't have these things. But, it's, to me, that idea, it's kind of like the whole, throw a witch in water, and if they float, they're a witch. If they sink, they're not a witch. But if they sink, then they drowned anyways, so they're still dead. It's a whole thing. Okay, let's move on. So we do have some synthetic blood-brain barrier impermeable analogs of neostigmine and pyridostigmine, okay? And these are used to treat the autoimmune disease Myasthenia gravis, okay? Don't really need to know that, but you should just know. But these are, again, inhibitors of the breakdown, but they are impermeable. Okay, so they're used to treat, deficits of acetylcholine in the periphery. Now, physostigmine, pyridostigmine, and neostigmine are all reversible inhibitors, so you can remove them. Okay, so even here with our calabar beans, if you don't go into a coma or death, eventually it will leave that acetylcholine receptor and you can recover from it. Okay, that's pretty much what it means. But it can still take some time. It still causes effects. So if you want to know more about Myasthenia gravis, it results from an immune response in the acetylcholine. So here, this is normal function that we talked about, and then this is the neuromuscular junction with Myasthenia gravis. And what you'll see is that a lot of the receptors on the muscle are blocked by antibodies, and that's that autoimmune response. Okay. What this does is attenuating response from the acetylcholine. So treatment is to prevent the breakdown of acetylcholine, because then we have more acetylcholine to act on the receptors that are not blocked to get that response. So we prolong the acetylcholine single on these receptors to compensate for the loss of function of the other receptors. Okay. There are some irreversible inhibitors of the acetylcholine esterase. So these are some things that we tend to, say, never use this again. One of them would be malathion. So this is a type of pesticide. I'm not even going to try that word, guys. It inhibits acetylcholine esterase inversibly. which means we have to wait for pretty much that cell to die and a new one to come. Insects are definitely more susceptible than humans in this, but it can still affect humans, and that's why this type of pesticide has been banned in Canada. It's taken a long time. I think it was in 2017 that it was finally banned in Winnipeg, which was the last holdout in Canada, but it's now banned all over Canada and in many other countries. We've now replaced it with a different type that blocks axonal sodium channels rather than the acetylcholine esterase. Now, two other inhibitors that are very big would be sarin gas and VX nerve gas. These are both irreversible acetylcholine inhibitors. These are very big, very super dangerous. The use of these, I believe, is a war crime, crime against humanity if you use these. So don't, okay? Cool. Sarin gas was infamously used in the Tokyo subway attacks in '95. I'm sure all of you are too young to have been around then, but I remember that. Very scary. And then there was risk of exposure in the Gulf and Iraqi wars because some insurgents got their hands on sarin gas because it was popular during the Cold Wars before we realized how dangerous it was. Okay? Now, one thing we can do, and in a lot of war areas, then periodostigmine is actually prescribed as a preventative against the nerve agent poisoning, because pyridostigmine competes for the same site as sarin gas and VX, and so sarin gas and VX can't have the effects, those horrible effects, because they can't bind, because those receptors are already being used by pyridostigmine, which we know doesn't have as big of an effect, aren't as dangerous, and are reversible in time. So it's a lot safer. Now, pyridostigmine was later found to have increased blood-brain barrier permeability under stressful conditions, so such as, being in a war. So it's actually been linked to one component of the Gulf War syndrome. So the Gulf War was in those areas, Gulf Wars, Iraqi wars, same area. Yay, the both Bush presidents. As an American, I can totally say that. So what we see with the Gulf War syndrome is confusion and ataxia, cognitive impairment, dizziness, balance. Notice these are things I mentioned before when talking about roles acetylcholine plays, and when I was talking about what happens when you don't have enough choline in your system, right? So what this graph is showing is on the x-axis we have the dose, so how much pyridostigmine was prescribed, and then on the y-axis is acetylcholine activity compared to the controls. Okay, so the stressed have less acetylcholine compared to the controls, and the unstressed, they start with more and then a little bit less. Okay, so unstressed, a little bit less than controls, stressed, a lot less acetylcholine. So you can see that. So this is again showing the importance of acetylcholine and how we can affect the amount of acetylcholine in the synthesis, in the release, and in the reuptake of this drug. So I'm going to stop this video here. In the next day's lecture, that'll be Monday the 19th? 17th. Monday the 17th. Then we will cover all the receptors that acetylcholine binds to and what roles those receptors play in behavior.